Hi, everyone, and welcome. I'm Tami, the creator of the blog and this YouTube channel called Nutmeg Notebook. And this is where I share with you all about a whole food, plant-based lifestyle. We are so excited to have everyone here today. If you are on our mailing list, you got our email today telling you this will be the last Sunday that we do our live show. We are actually moving to Thursday mornings at 9 o'clock starting this coming Thursday. And so we're very excited to get our weekends back and have the opportunity to spend more time with our family and our grandkids, because the weekends is when the moms and dads aren't working, and that's when they want to go and play. So now we're going to get to go and play with them as well. So we're super excited about that. We have enjoyed being with you live on Sunday nights, and we hope that many of you will be able to move to Thursday mornings with us. But if you can't, just know you can always watch the replay. And if you want to save the replay for Sunday night at 4 o'clock, you can do that as well. So thank you for supporting us and showing up here on Sunday nights. We really appreciate it, and we'll look forward to seeing you on Thursday. If you want to ask questions today of our guest, you are certainly welcome to do that. We have the chat feed going. If you would just preface your questions with 3 question marks, then end with 3 question marks, that will just help your questions pop out to Tom as he's over there moderating the chat. We also have Jesse, Randy, and Tiffany in the chat feed, and they'll help bring our attention if we somehow miss your question. They will put it in the chat for us again, and they can answer simple questions for you as well and help you know what's going on in the program. So let's get started. I'm so excited. We have a doctor in the house with us today, Dr. Niki Davis. She was a rocket scientist. Yes, it's true. She was a real rocket scientist who turned life to an who turned lifestyle medicine physician. She is board certified in both family medicine and lifestyle medicine. Her passion is to educate others on how to prevent and reverse chronic disease through a whole food, plant-based lifestyle. She has been lucky enough to train with phenomenal mentors and ones that we as much as she does, including Dr. John McDougall, Dr. Michael Clapper, Dr. Anthony Lim, and Dr. Alan Goldhammer, among others. She has a certificate in plant-based nutrition from the T. Colin Campbell Center for Nutritional Studies through eCornell, and is also certified in the starch solution. She feels extremely grateful to be doing what she loves every day, helping people live their best lives. Dr. Davis is also available for telehealth appointments in several states around the country and also international consults. And we are going to be talking a lot more about that. So please, everyone, help me welcome Dr. Davis. I'm so glad to have you here.
Hi, Tami. Thank you so much. It's so good to be here.
So we got to meet because we both had content in the Ultimate Weight Loss Bundle. And so we were able to meet then, and we did a live chat on Instagram. That was really fun. And so then I was so excited to be able to have you come on the show and share your knowledge with everyone here. We did get some questions ahead of time. Some people emailed them, and others will be asking questions during the live chat. But first, I thought it would be really nice. Well, you probably want to talk about how you went from being a rocket scientist to lifestyle medicine first. And then if you could talk a little bit about lifestyle medicine and what is it, so that people will have a better understanding.
Sure. Yeah. Kind of an interesting story as to why I quit my job at a rocket factory to become a lifestyle medicine physician. But I would say that really what ended up happening was even as a young kid, really enjoyed math and science. I liked inventing things. And when I went to go into college, I actually had thought about doing medicine, but I honestly at that time thought it would take me too long. And now here I am in my second career, I know. But yeah, so I was looking at what would be a good fit for me, and engineering kind of fit, the math and science and inventing and problem solving. I also really liked that it was a challenge. I actually liked the idea that I was one of the only women doing it as well at the time. I know there are more women doing it now, but at the time, there were only a few of us out of a couple of hundred. So, and I have to say, I really did enjoy working on rockets. So I worked on the space shuttle program, and it was an interesting job. But what happened was I had started my transition to a plant-based diet before becoming an engineer. And while I was working, I was learning more and more about nutrition, plant-based nutrition, becoming more passionate about it, buying books and just watching videos. And that soon became very overwhelming, but that was what I was excited about. I was seeing my own health improve, the health of friends and family improve. And so then I was starting to look for a way to incorporate this more into my life, and decided to just quit my job. So left my job as an engineer and went back to medical school with a 6-month-old.
Oh my goodness. That is what I call dedication.
Right. And not only that, as an engineer, I was working 40 hours a week, getting paid really well. And then I suddenly had to be a starving student, a medical student, paying for school, and doing 80-hour work weeks. But still, once I started that path, it was just this, okay, this is what I meant to do. And I was excited about it. And of course, you have hard times during medical training, but I always knew what my goal was at the end of the road. And now I get to live out my dream, which is help people get better.
Yeah. So it's so amazing. So, can you talk to us about what lifestyle medicine is, and what is the difference between lifestyle medicine and conventional medicine, which conventional medicine is what you learned in med school, right? So can you kind of help us understand the difference?
Absolutely. So yes, I am trained in conventional medicine, not only through medical school, but in residency as well, family medicine. And I would say that not only in medical school, but in my residency training, you are taught to talk to people about lifestyle, about making sure they have a healthy diet, that they're getting exercise. But honestly, we're not really taught what that looks like, how to even have that conversation, how to help people transition to a healthier lifestyle. And so what ends up happening is we will tell someone, okay, we don't have to start this medication today. We'll give you a chance to go out and do whatever it is you're going to do to improve your lifestyle, and then come back and see me in a few months. And if things aren't improved, we'll start that medication. The difference is with lifestyle medicine, now you're taught how to actually help people make that transition. The other part about it that's interesting is conventional medicine, if you really look at what we do mostly, it's diagnose something, and then we look at whatever treatments are available for that diagnosis. And a lot of times it's medications. We do a lot of medications, surgeries. And really what ends up happening is I'm very responsible for that patient, right? I am responsible for figuring out what medication you need to be on. I write a script, I send you off. And all you have to do is just follow my instructions. You take the pill, you go get the surgery, you're more passive. Whereas lifestyle medicine kind of flips it around to where, as someone who's practicing lifestyle medicine, now I will kind of walk you through the steps of how to make this transition, but really the onus is on you. You're the one who has to go through and clear out your pantry. You're the one who has to, pencil in that you're going to go on a walk every morning. You're the one who has to figure out how are you going to do this socially, or is your spouse supportive? Are your friends and family supportive? That's a lot. And so you are more responsible for your own health, whereas I'm just there kind of helping you through that process. So I'm more of the passive role, whereas you have to take on more of that ownership of your own health. But it's fabulous because I get to see people not just managing their chronic disease and getting, honestly, most people get worse over time, even when they're taking the medications they're supposed to, the things that research is telling us that people should be doing. But, I get to see people getting well and getting off medications. That's what I get to do a lot, is helping people get off of those medications and start feeling better.
And I love that. And, every plant-based physician that I have talked to has said, once they learned about the plant-based lifestyle and lifestyle medicine, that was like the first time in their career that they actually saw patients getting well. And how exciting that is for you as a doctor, because it's disappointing and a little bit defeating to be treating patients and have them continue to be ill.
Right.
And so it's like you actually have treatments and lifestyle suggestions for people that are going to improve their life, reverse their disease, make them better. I mean, that has to be like so rewarding, right?
It is. And I have to say, I hear a lot, unfortunately, from people who say, why didn't my doctor tell me about this 20 years ago or 10 years ago or 5 years ago? Why am I just learning about this? It's not like a plant-based diet, came about last week. It's been here for a while. We've known, a lot of the research that's been done has been over the last many decades. So it's unfortunate that a lot of people still don't know. And that's why it's so important that you're doing what you're doing and helping spread the word so that people know that this is a choice. We can improve things like obesity and hypertension, cholesterol, diabetes. We can, and it's absolutely out there and available.
Yeah. And so I think too, one thing, all of our TV commercials and the ads in the magazines and all of that are all about medications. And so we've kind of been conditioned as a society as well to think that when we go to the doctor, they're going to have a pill that they can give us and it's going to be easy. That's going to be the fix. We can just take the pill and then we don't have to change anything. So part of it is patients going in and asking for medication too. I think, we've just become a society where that we just want it to be that easy. If you could just give me a pill, I would just be fine,
Well, yeah. And on top of that, people are sick of even just trying to change their lifestyles. They've,
Yes.
yo-yo dieting and not really knowing how to get healthy and not having your doctor telling you how to go about getting healthy and improving your health. And so at some point you say, well, I don't want my blood pressure to be this high, and because that can increase my risk of other things down the road. And so I guess I have to take this pill when really there are other ways.
Yeah.
And
But the
that's why it's
doctors,
so great.
right. And conventional doctors don't always tell you that there is a choice. Like when the reason I originally adopted this lifestyle was because my LDL cholesterol had been climbing for a couple years in a row. And my doctor said, well, you're already doing so many things right. This is just genetics, your parents have it and, you're just going to have to go on a statin. Nowhere in that conversation did he tell me that there was anything that I had the power to do in changing my lifestyle. I had to go do my own research and I'm like, I don't have to go on a statin.
Yeah.
I have choices here, So,
Yeah.
so when you were you already knew about the plant-based lifestyle when you started medical school. Did you know about lifestyle medicine when you entered medical school?
No, lifestyle medicine was around prior to me going into medical school. I think the American College of Lifestyle Medicine started in around 2004, but to become board certified, board certification is basically your specialty: family medicine, internal medicine, surgery. But now people can become board certified in lifestyle medicine as well. And that's only been around since, I want to say it's 2016, maybe. So not very long that physicians have been, and any healthcare provider really has been able to go in and actually become board certified in it.
Okay. So then your exposure when you had the opportunity to go to the McDougall 10-day program, then is that where you were just really saw big results happening?
Yeah, I would say that really, I was already eating plant-based at the time, but I was definitely still allowing some oil in my diet and more processed vegan foods. And so being in that environment where so I was a medical student with him, and I got to not only learn from him and sit in on his patient consultations, but I also got to kind of be a patient in a way where I got to have my labs done before and after. I got to eat the food for that amount of time. And what was great was not only getting to see all of the changes and benefits from all of these patients, but also for myself, because I saw, wow, eating, getting rid of all the processed, eating really whole plant foods, getting rid of the oil, I feel amazing. I've lost a little bit of weight. And we were talking about the LDL cholesterol, your bad cholesterol.
Yeah.
My LDL number dropped by 20 points during those 10 days. And I mean, I was just in my 30s at the time. And not that I had any cholesterol problems, but the fact that it was able to drop that quickly is pretty amazing. So that really set it for me, where I said, okay, this is definitely what I'm meant to do. And it makes such a difference having a healthy plant-based diet.
Yeah, that's pretty remarkable in just 10 days, to have such a big result. So it really does reinforce the power of plants.
Yes.
So then after you graduated from med school, then where did you learn about telehealth, and how did that come about?
Yeah.
And what is it? Let's tell people what it is. A lot of people may not even know. What is telehealth?
Right. Yeah. So I would say I knew about it during training because it was something that was starting to become more popular, but really, I have to say probably the pandemic really kind of brought it more to the forefront. And when I was graduating from my family medicine residency program, I found plant-based telehealth when they first started. And so I had reached out to them because it was kind of a great fit where I could not only help people making changes with their lifestyle, but I could do it from my home or my office and be able to reach people in all different states, all different countries. So just, the access was there. So lifestyle medicine not lifestyle medicine, but telehealth in general is basically you're seeing a provider through like a Zoom, just like you and I are doing right now.
Yeah.
It's just like this. And we actually do use Zoom. So it's very similar to this. And I know probably through the pandemic, a lot of people have learned how to use Zoom for so many different things.
Yes.
But the nice thing is it makes it a lot easier. You can do it from your own home, the comfort of your own home. I don't care. You can wear sweats if you want to, you can be comfortable. And the other nice thing is that you're not having to block off a huge amount of time because you don't have to worry about driving to the clinic, parking, going inside, waiting, and then seeing your doctor for that 15-minute visit, which doesn't always even allow for 15 minutes because you've got some time that you have to see the nurse and you might be getting your blood pressure taken and all those things. So it ends up being a really long amount of time that you have to book for your appointment, and then a very short amount of time that you spend with your doctor. Whereas with telehealth, we start right when your appointment starts. We both log in together and see each other right at that time, say 9 a.m. And we do longer visits. So the company that I work for, Plant-Based Telehealth, we do 30 and 60-minute appointments. And what's great is that we also have a really long questionnaire, something that takes some time to fill out. But what is great for me is that I can then go through that questionnaire before I've even met you. I can get all of your back data. I can see what medications you're on, what diagnoses you might have, what your concerns are. And then when we have that 30 or 60 minutes, we just get to talk. We get to go through all of your questions. You don't feel rushed. It's a really nice way of having a doctor visit where you can really talk to your doctor and get some really good input and not feel like they're thinking about their next patient that they need to run out and go see.
Yeah, I love that. It sounds wonderful. So let's talk about some particulars about it. Is plant-based telehealth covered by people's healthcare insurance?
So right now we don't work with any of the insurance companies. So it is just a cash pay, but we do try to make it a reasonable price. And we do have people who use like a health savings account to pay for the visits. We do also have what's called a super bill that we can give to people. And we have had people submit that super bill to their insurance and have it either partially refunded or fully reimbursed. I would say that's not the norm, but it's definitely something that I recommend to people that you at least try to see if that's something that you can get reimbursed through your insurance. So I would say most people use an HSA account if they have one to help.
Okay, great. Then I saw, because I went to the website and looked around, and I saw that some of the doctors do say now taking Medicare patients. And
Right.
so not everyone, but some.
So
okay?
it's a little bit complicated the way it works, but basically what you need to know is that if the provider has opted out of Medicare, and all that means is that so for instance, I'm opted out, but what that means is that I cannot try to get reimbursement for that visit. The patient cannot try to get reimbursement through Medicare for that visit. So it allows me to actually see a patient who has Medicare. So being opted out just means I can see you and you can pay cash for that visit. Some of the doctors can't opt out because they see other Medicare patients in a different setting. And if you're opted in for Medicare, where you reimburse through it, then you have to be opted in for any way that you see patients. And so that's where some of our providers still do some in-person visits, and they just can't see Medicare patients through the telehealth.
Okay, that makes sense. So we have a couple of questions. Robbie wants to know if that Robbie lives in Virginia, and can Robbie see you? So let's talk about what states you are licensed and that you can see people, and how that works.
Sure. So first of all, plant-based telehealth between all of our doctors, which I want to say we have 10 now. We're looking to expand to, I think, 13 or 14 this summer. But between all of the physicians, we can see people from all 50 states, DC, and all over the world, any country as well, for consults, international consults. Me personally, let's see if I can get these all right. So I have Arizona, Alabama, California, Colorado, Florida, Louisiana, Montana, Utah, Washington, and I'm working on Oregon right now. So that should be very soon.
Wow. Okay. And it tells on the that's a lot.
Yes.
You're licensed in a lot of states. And it tells on the website, it tells you the doctors,
which doctors
are licensed in which state. And is there a search too where you can put in the state you're
Yes.
in and then see who is there? And you can read
exactly
profile. Every physician's profile as well.
And I did want to mention that the way that it works is that our visit you need to be located in one of those states during our visit. So for instance, just because you live in California does not mean that you need to find someone who's licensed in California. It matters where you are located during that visit. So if you're on a vacation to Florida and you want to have a visit with one of our physicians from your hotel room, you just need to make sure that they're licensed in Florida. So wherever you're located at the time of the visit. And so I will talk to my patients about that as well, because when they sign up, a lot of times they're signing up for the state in which they live in, because that's where they normally are. But then I will sometimes have people who are traveling, or maybe they just live really close to a state line and they work across the border, that they always have to be at least located in one of the states that I'm licensed in during the visit.
I love that, because that opens up a lot of opportunities for people. Another good question, how does using technology and having the consultation on Zoom, how does Zoom protect the patient's privacy?
Yeah, so if you're familiar with HIPAA, it's HIPAA compliant. So the Zoom platform that we use is all HIPAA compliant. We also use an EHR, so an electronic health record service. It's a platform called Charm Health, and all of that is also HIPAA compliant. So if you want to send a message to me between visits, like, hey, my blood pressure is getting a little bit low. Do we need to drop my medication? You can send a message to me through that portal, and that's all protected.
That's great. Are you able to prescribe medications and order lab work for people?
We can. So yes, absolutely. We can prescribe medications, and the labs that we use are Quest Diagnostics and LabCorp, which are the two main, lab providers in the country. And sometimes people don't really care which one they use, but sometimes your insurance will help cover it if it's either through Quest or LabCorp. So we can discuss that and figure out which one would work best.
And so those two organizations have like local labs across the country, so people can find a local lab and go to it. Okay.
Yes. Yeah. So they have not only lab locations, but sometimes it's even inside a hospital where you can go get your labs drawn. So it really kind of depends. So you can call the main company and find out what's going to be the closest one for you.
Okay, that's great. So do you end up becoming the patient's primary care physician or not?
So because we're telehealth, we are not your primary doctor. Now, I will say that there are some people that just don't have access to either a supportive physician or even a physician that's just even in the area that they can see on a regular basis. And so sometimes we tend to act somewhat as a primary doctor, but at the end of the day, we are not your primary doctor. We are lifestyle medicine doctors. And our job is really to help you through this lifestyle transition. So it's preferable that you can't, because we can't see you in person. So if you're telling me, for instance, your heart's skipping a beat and you're noticing, you've been feeling dizzy or things like that, I can't reach through the screen and listen to your heart, unfortunately. And so that's where having someone local for those acute issues, it's just so important, because you just never know when you're going to need someone in person. There's only so much we can do through telehealth.
Right. But let's say if you're having issues with blood glucose, borderline diabetic, or you have hypertension, and you start to improve your diet, but your doctor doesn't understand plant-based, and so he's not sure like what's going on with you, and then so maybe then you want to have a consult with a plant-based physician like yourself. Do you ever then work with the patient's primary care physician to kind of help them understand what's going on, or coach your patient so they can go back to their doctor and explain to their doctor what's going on?
Yes, definitely. Okay. So all those things. So we can absolutely work with your primary doctor. Happy to have a conversation with them if we need to. One of the other things that sometimes people will do is they will see us and improve and maybe even get off their medications before they go back and see their primary doctor. And then when they go to see them, their doctor will say, well, okay, now your blood pressure is in a place where I'm not going to need to start that medication. Or, oh, your cholesterol's in the normal range, so we do not need to start that statin. We help you get well, and then you get to go back to your primary doctor. So sometimes it works that way, where they just maybe either delay their appointment with their primary, or they see us for a short time between visits with their primary, or if we need to have a consult with one of their specialists, doctors, or primary doctors, we absolutely can do that and work with them.
And are they receptive? Are the doctors receptive to that? Have you?
Yeah, I would say sometimes no. There are sometimes going to be some doctors that are just not supportive of a plant-based diet. They just don't know the research. They don't know the benefits of the plant-based diet. And so I will have patients that say, my doctor is just not supportive of this, and so that's why I'm coming to you. So there are those cases, but I would say that I'm seeing more and more as time goes on, doctors being more aware of lifestyle medicine and plant-based nutrition, that are becoming more supportive, but they don't know how to best help their patients through making the lifestyle change, and also titrating off medications is not something that we really learn when we're going through training, because it's just not something that comes up that often. And so they, a lot of times, will feel comfortable handing that off to us to help out, because that's our specialty.
Yeah, that makes perfect sense. That's great. Okay, are you ready for a couple questions from some of our
Yes.
viewers? Okay, great. Okay, so George says, for patients with an elevated cholesterol level, non-familial, is there a need or a role for statin therapy? And do you think that in the future, the use of statins will go the route of bloodletting in medical therapy?
Ah, interesting. So I would say that there are certain circumstances in which I will recommend that someone might need to stay on a statin. And especially with people who have severe heart disease, which we can see in imaging and lab work. So, and it really is a case by case basis. I would say that for most people, they are able to improve their cholesterol just by improving their lifestyle. But sometimes people will need a little bit of extra help. And we do have things like the plant-based telehealth doctors. We do have kind of some little tips and tricks for helping improve cholesterol even more through some additional things that you can do prior to even considering a statin. We really try to get you into the best place possible to decrease your risk overall through lifestyle changes alone. And I would say it's somewhat rare that we really rely on a medication for cholesterol unless absolutely necessary. And we look at, do the benefits outweigh the risks? That's really, when you're looking at it a case by case basis, you've got to make sure that it makes sense for that particular patient.
Yeah, that makes really good sense. And I heard one of the plant-based doctors was talking about this subject at one point in time. And they said that, there can be a tipping point. There can be like where too much damage has been done. The lifestyle changes didn't come soon enough. And, so not everybody's going to be able to reverse their, disease, but they can certainly improve upon it. And so sometimes
Yes.
medication is still needed and valuable. And I think it's important for those of us who are adopting this lifestyle to recognize that and accept it. And it doesn't mean that we've failed because we still found the lifestyle and made some changes. So,
Well, and Tami, I love that you bring that up because I do see that we're so used to seeing all of these webinars and podcasts and people going out there saying, I switched to a plant-based diet and this reversed, this reversed, this reversed. I'm completely 100% healthy. My cholesterol is fantastic. And then there are other people who go and make this lifestyle change and they have a lot of great benefits, but they aren't able to completely reverse everything. And it can be disappointing, but you've got to remember that you've had, for some people who've had a lifetime of insult to their bodies because of, the lifestyles that we've led for so many years, there's only so much healing that can happen if, depending on how much damage has been done. So we definitely still see benefit in most people, but there are going to be some people that we can't completely reverse everything, just depending on everything that they've been through.
yeah, absolutely. Okay, thank you. Here's another question from Gail. She says, can you please ask Dr. Davis what brand of B12 and D3 she would recommend? I'd also like to know what Tom and Tami take. And could you ask her if a person should take K2 if they have osteoporosis? And if the answer is yes, is there a brand that you would recommend?
Sure. So for B12, the one that I personally take is called Twin Lab B12 Dots. They're available on Amazon. The reason I chose those is because it kind of goes along with the things that I recommend in a B12 supplement. So I recommend that it's the cyanocobalamin version of it. So there's methylcobalamin and cyanocobalamin. Dr. Greger did a really great, thorough, deep dive into the research to see which one looked like it would be the better absorbed version. For most people, cyanocobalamin seems to be the best. So that's typically what I go for. The other thing is making sure that you're getting a good amount. You don't need to get a ton because you can only absorb so much. So 500 micrograms a day is usually what I'll recommend. And then the other thing that I recommend, because by taking 500 micrograms, you might get maybe 1 to 2% of that. So you want to make sure that it absorbs as best possible. So swallowing a pill isn't going to help it absorb as well as if you have something that is either a liquid, a sublingual, or a chewable that you let dissolve in your mouth. So those are the kinds of things that I'm looking for.
Okay. And so that was Twin Lab. And what was the rest of it?
Yeah, Twin Lab B12 Dots.
Okay.
And they are vegan.
Okay. And then what about the D3?
Yeah, so D3, I would say similar recommendation as far as trying to get something that's better absorbed. So a liquid or a spray. But really, honestly, most of the D3s are going to be just fine. It doesn't really matter to me which brand you use. So it really kind of depends on your level of vitamin D. I don't typically recommend that everyone takes it. I like to have people supplement if they actually need it, if they're deficient. So that's another thing that you want to make sure that you're getting your levels tested and be on a good amount that you need to be able to get your level up if you're not able to get enough sunshine.
Great. And then she asked about K2. Should someone take
for
K2?
osteoporosis?
Yes.
Yeah. Oh, and I was going to mention too, with any supplement, you want to make sure that it's third-party tested. That is one thing that you want to make sure of when you're buying any sort of a supplement. I don't recommend K2. So for osteoporosis, some of the main things that you need to be aware of and make sure that your body has enough of is calcium, vitamin D, and magnesium. And those are all things that we can check in lab work to make sure that you're doing well. And honestly, with a plant-based diet, you should have no problem getting the calcium and the magnesium. Vitamin D, obviously you're going to need to get some sunshine. And if that's a problem for you, then we might need to supplement that.
Okay, great. We have another question. Vajana wants to know, what do you feel needs to happen for the medical establishment to start telling patients what they need to hear rather than what they want to hear?
Well, I feel like we're starting to head down that road. So one of our doctors at Plant-Based Telehealth, Dr. Clapper, I'm sure most people have heard of him, Dr. Michael Clapper. So
Yep.
He's one of our doctors, and he's starting to help put education into medical schools to help teach our medical students about nutrition, plant-based nutrition, lifestyle medicine. So that is in the works. And I think that we are going to see more and more, not only physicians, but nurse practitioners, physicians assistants who are learning about lifestyle medicine. I think I'm starting to see it more and more, that more people are learning about it and interested in it.
Yeah. And some of the physicians are learning about it from their patients. Like my husband had an experience with his doctor. He got a new primary care physician who wasn't familiar with plant-based the first year he saw him. And, we don't very often have to go because we're so healthy. But then the next year when he went in for his physical, he was telling Tom, hey, I had somebody come in who reduced their LDL cholesterol, and it was from a plant-based diet like you're eating, and so I thought, oh, isn't this great that not only did his patient come back and educate him about it, but then he shared that with Tom. Oh, I have another patient who's eating like you and having really great results. So I thought that's exciting. So we do need to tell our doctors what we're doing as well, I think.
I agree. I think sharing the information with your doctor is step one, but really what I think makes that deal great is when you can come back to your doctor and show them the health improvements that you've had, because that really allows them to say, now, wait a minute, I think I need to look into this more, because this person, their cholesterol was so high, and now look at how much it's improved in just a few months. There's got to be something to this. And so people are looking into it because we're seeing those results. And I see those results all the time. It's very typical. So it's happening.
Yeah. Right. It's exciting. I like that. The disclaimers on TV, on the commercials for weight loss programs or this and that, results not typical. Well, it's the reverse for us. results are
Exactly. Isn't
I
that
love
great?
that.
Yes.
It is great. Kelly has a question. She's talking about the on the telehealth website. What is the difference between the new patient appointment and the plant-based immersion appointment?
Okay, so if you are just looking to make your first appointment with one of the plant-based docs, then you want to choose the new patient evaluation. There is an immersion program that you can do with us where you will be sent some food products. We will do labs before and after. So it's more of like a jumpstart program. And that's something that you would just sign up for.
Okay, perfect. Thank you. Okay, another question. Now, this is the one that I emailed you about as well. So this is from Wanda, and she wants to know, does an insufficient intake of dietary protein contribute to the loss of muscle mass as we age? Are there age-related differences in the muscle anabolic response to submaximal doses of essential amino acids? Do older adults synthesize a significantly lower amount of muscle protein compared with younger adults? And is there a time or a reason that Dr. Davis would recommend supplementing with protein?
Great. So I love talking about protein. Protein is one of those things that most people don't even have to worry about on a plant-based diet. There is a disease that you can get that is protein deficiency, kwashiorkor. But what we see is that it usually only happens in people who are calorie deficient as well. If you're not getting enough calories, you're likely not getting enough protein. The World Health Organization has told us that we really only need about 0.5 grams of protein for every kilogram of body weight that we have. And that ends up being only about 5% of our daily calories that we need in protein. Now, of course, if you are a strength athlete, you're going to need a little over double that. If you're an endurance athlete, you're going to need about triple that. So if you're an athlete, you are going to have a higher protein requirement. Now, as you age, you are getting plenty of protein through your diet. And if you're noticing that you're having, lower, your muscle mass is lower as you age, really what that tells me is that you need to get good physical activity, because that's really what we need to continue to keep our muscles going and staying strong. And then really making sure that you're getting enough calories. As long as you're getting enough calories on a plant-based diet, you're going to be getting enough protein.
Okay, then what about as we age? I think she's referring to some of the articles. I've read some too that, where maybe our body doesn't absorb or utilize the protein as well as we get older. So like, how do we know that? How do we know if that's happening to us?
Well, and that is something that you want to be making sure that you're getting enough as you age, but I don't recommend that you supplement with protein, because people who are plant-based on average get double the amount that you need daily. So you're already getting plenty. And as you age, if your requirement goes up a little bit more, you're still going to be getting plenty.
Okay, great. Thank you so much.
Sure.
We have another question. And since you worked at True North Health Center for a while, you're very familiar with water fasting and probably also intermittent fasting. So Tiffany wants to know, what are your thoughts about intermittent fasting?
So I think that intermittent fasting is probably natural for humans to have a fast between meals and to fast overnight. It makes sense to me that as it gets dark outside, as it gets closer to dusk, that we stop eating. We're not going to be out looking for food in the dark. It's hard for us because we have access to food all the time, at any time of day, really. And we tend to stay up later than we really should. As it starts to get dark, that is naturally when you should start to get sleepy and ready to go to bed. But a lot of us are staying up on our devices. We're working late. we want to relax and watch Netflix, whatever that is. And what ends up happening is that if you want to stay up late, eating will help you stay awake and stay up longer. So intermittent fasting allows us to kind of go back to our natural, what we've done naturally as humans, which is you stop eating as it gets around dusk time, and then you don't eat all night long until the morning time. And that tends to be at least 12 hours, if not up to 16 hours at a time. Now, I will say that I have found better results if you do intermittent fasting where you stop eating earlier in the evening, as opposed to some people will eat later on in the evening, but then not have their first meal of the day until, say, noon or 1 o'clock. Whereas I would prefer that your last meal of the day be earlier on so that it allows your body to fully digest before you go to bed. And then when you wake up in the morning, you eat when you're hungry. So you're not just waiting until later in the day to have all of your meals. Your meals are more earlier in the day. And I think that that is very natural.
And being able, having the opportunity, the awake hours to work off those calories that you've ingested. I know, I used to be in the habit of eating really big in the evening for my evening meal, but then I go to bed at 10 o'clock. So I don't have time to burn off those calories before I go to bed. So,
right. Well, and you don't want to have your stomach full of food while you're sleeping, because your body is going to have to work to digest that food. And so what it does is it puts all its energy into that instead of what it could be doing while you're sleeping, which is going in and cleaning out your cells, getting rid of toxins, repairing DNA. All the beautiful things that are supposed to happen while you're sleeping can't happen if your stomach is full of food.
Right. Makes sense.
Randy wants to know, if we're not supposed to eat at night, why did they put lights in our refrigerators?
Good one, Randy. That's a
That's
good
pretty
one.
good. That's pretty good.
Okay, so the other thing I wanted to talk to you about was hypothyroidism. So as I was sharing with you before we went live today, I was diagnosed with hypothyroidism about a year after I went plant-based. And, I'd had some symptoms the year before, but on the particular day that I was tested, my numbers were within the normal range. And so they said, oh no, you're fine, Okay, so a year later, a lot more symptoms got tested and needed to go on a hormone treatment, levothyroxine. At the time, I'm on the lowest dose, but I get questions from people all the time when they find out that I am hypothyroid. They were like, well, why didn't your diet reverse it, reverse course with that? Why didn't it help you get better? Have you tried going off? I'm like, no, because I get tested every year and I am like right where I want to be. So I don't want to mess with it. Why would I mess with it? I'm doing great. Perhaps, I don't know, but perhaps my healthy diet has prevented it from getting worse and causing me to have to take more hormone treatment. So, but people write to me all the time because they're concerned. They want to be able to get off their thyroid medication. So could you talk about thyroid and medication and the plant-based diet? And some people have asked me as well, do you think it's because you went SOS free? And so you had a deficiency in iodine because you gave up table salt. Well, I didn't give table salt up initially. That came later. But anyway, your thoughts.
Yeah, so great questions. And hypothyroidism, so that's where you have low thyroid hormone, is very common. And it is typically for most people, it is an autoimmune disease. So you have your own cells attacking your thyroid. And that's why it makes it difficult to completely get off the medication, because you can improve your blood flow to your thyroid. You can improve the fat stores that are maybe causing it to not work as well. There are so many things you can improve, but to get rid of those autoimmune cells is pretty difficult. I will say that most people that I work with who are plant-based do require less medication over time as they transition to plant-based. So I definitely do see improvement there. Whereas I normally see the opposite in people who are eating a standard American diet, that over time they tend to need more medication, higher levels of the hormone replacement. So there's that part of it. Now, I will say that there are some people that if we are catching it very, very early and it's very mild, that some people are able to stay off medications for some time and some people indefinitely. We don't know exactly why certain people are able to do that, but there are some people that I would say that that's, on the rarer side, that mostly what we see with the plant-based telehealth patients that I work with and the other doctors that they work with, that we see improvement, but we don't see as much complete reversal.
So, Dr. Davis, do we know why it happens in the beginning? What triggers that autoimmune response?
Yeah.
Do we have any idea what happens?
Yeah, well, I will say that one of the theories out there that Dr. McDougall talks about, you can probably search and find a video or an article where he talks about this, but there is concern that we are actually consuming in our diets some level of thyroid. I know that sounds disgusting, but in meat products, you're probably getting some of that in some meat products. And you might even be getting some byproducts of, hormones and things like that through dairy products. So you're probably getting some sort of cell in your body that is not a human cell, that is very similar to what our thyroid cells look like. And if it's so similar, but it's different enough that your body says, I don't want this in here, I'm going to destroy it. Just like if a virus enters your body or a bacteria, if it's a cell that it doesn't recognize, it's going to go in and it's going to create cells that will then try to remove that from your body. But the problem with that is that if it's so similar to your own tissue, your own thyroid tissue, then that's where your cells can then attack those tissues in your thyroid that look so similar to that animal protein. So that's where there is that theory that we wonder if it's due to animal products where they're just similar enough, but just different enough to make that possibly happen.
Okay, that makes sense. And what about going gluten-free? Does adhering to a gluten-free diet help people that have thyroid problems?
I would say that I haven't seen enough really good research that shows that will improve hypothyroidism. For some people, there is sensitivity to gluten. So if you are one of those people that's sensitive to it, or you have a celiac, which you're intolerant of it, then it makes sense. But as far as getting off gluten to try to help your autoimmune disease or your hypothyroidism, I don't typically recommend it. I think if you're able to tolerate gluten, then there's no reason that you should be trying to remove that from your diet.
Okay, great. Thank you. So I hope that helps people with the thyroid issue, because so many women seem to have hypothyroidism. Is it more prevalent in women than it is in men? Do you know?
Yeah, it seems to be more prevalent. I mean, definitely men are still getting it too, but it does seem to be more prevalent in women.
Okay. We have another question from Kim. What are your thoughts about biologics like Humira for arthritis? Have you seen people be able to get off of them when they've adopted a plant-based lifestyle? Psoriatic arthritis.
Mm-hmm. Yeah, so we do see benefits with people who have either autoimmune type arthritis or osteoarthritis, where even just switching over to a diet that's very low in inflammation, high in nutrients, that we do see people improve those conditions, and sometimes they're able to get off those types of medications. Yes.
Okay, that's great. Shelley wants to know, speaking of medication, what does Dr. Davis think about a plant-based diet for helping people get off antidepressants?
Yeah, so absolutely. So we've had quite a few people come through plant-based telehealth who've had improvement just with changing their diet over to a plant-based diet. So that is absolutely something that if you are struggling with any sort of, mental health issue, considering switching to a plant-based diet makes a lot of sense. And I've seen people get off medications and do really well. So it's definitely something that I would highly recommend. We also know that there is something to do with our microbiome. So the bacteria that live in our body, that if your microbiome is the kind that really feeds off of a standard American diet that's heavy in animal products, that you tend to have a higher risk of having some of these mental health disorders. Whereas if you have a microbiome that feeds off fiber and plants, your microbiome does change. We know that it changes as you change your diet, and that having a microbiome of a plant-based eater tends to put you at decreased risks of those things.
Isn't that amazing? I mean, what we're learning about the microbiome and the rest of our health is just so fascinating.
Yes.
So we just want to have a really diverse plant diet and eat a lot of different plants. I'm guilty as charged of getting in a rut and just buying the same stuff week after week. But, after learning about all this, it's like, oh my gosh, I need to try a lot of different variety of greens and grains and, just really up the quantity of diverse plants that I eat over the course of a week or a month, just trying to change it up because it makes such a big difference. Tiffany wants to throw a little fun in there. She says, what does Dr. Davis do for fun? And what is one of your favorite meals?
Okay, so what do I do for fun? Well, I am very happily married with a 9-year-old little boy. And so my fun is hanging out with my family, spending time with my family. And in the winter time, we love skiing and snowboarding. And then I would say that pretty much all the time, we just love being outside. So we love just hiking and camping. And one of my favorite things to do is just walk. I love walking throughout my neighborhood. That's how I get my physical activity for the most part, is through walking. So those are the kinds of things that I love to do. And of course, I've got little hobbies here and there that I love as well. But for the most part, I would say getting outside and spending time with family.
Nice. And you like to cook. I've seen you do some cooking.
Yeah.
On Chef AJ's. So
yes.
What would be one of your favorite meals?
Okay. Well, first of all, I have to say my favorite food is definitely potatoes. So any kind of potatoes or sweet potatoes are the food that I would choose on my island. So any way you want to make them, mashed potatoes, air fried. I see you've got the air fryer that I have. Any way that you want to make a potato is going to be my favorite. But lately, what I've been really enjoying is making tostadas. And it's really simple. I buy the little corn tortilla that's just corn, corn, water, and lime. And I toast those up in my air fryer, make them nice and crispy. And then I just do some fat-free refried beans on top, and then just whatever toppings I've got. So chopped tomatoes, some red onion. I usually have like shredded cabbage or some greens that I'll put over the top, and some salsa. And that's what I've been really enjoying lately, is having something like that.
I'll come over and join you. Mexican food's my
favorite. Right? So good.
It's so good. And it's so easy to make those tostadas shells in the air fryer. It just takes a few minutes. They're so good.
Well, and you can make nice corn chips too, using those same things. You just cut them up into little pieces and you've got nice oil-free corn chips.
Yeah. And salt-free. I mean, it just doesn't get any easier. And what's interesting is, whoever I'm talking to in the plant-based community, most of us eat simple food like that.
Yes.
It doesn't have to be fancy. It's, once you have neuroadapt and you can just enjoy the flavor of just regular plain food, we're so happy to eat simply. It makes it so easy. Not a lot of prep, not a lot of cleanup, but everybody's happy. And your little guy, he likes all of his plant-based food as well.
He does. Yeah. We call him our little Viglet. He's been vegan, plant-based since birth. And so he doesn't really know any different, but we've never had an issue with him eating food. He eats all the foods that we eat. And I know I've told this story before, I think when I was with Chef AJ on her show once, but there was a time when, so we're the same as you. We like to eat really, really simply. We keep it really simple, really easy. And one of the things that we make a lot is just brown rice or barley or some sort of a grain with broccoli, and then maybe a little bit of air fried tofu. And I remember one night we were out of broccoli. So I think it was just barley and tofu for him. And he looked at his plate and he said, "Where's my broccoli?" And he started just bawling. He was just crying. And I thought, I have done something right if my kid is crying because there's no broccoli on his plate. But really at the end of the day, if that's what you're feeding them, that's what they're going to be used to.
Yeah.
We've never had an issue with him being picky. He's always loved the food, and it's
love
great.
that story. And so, do you have to pack his lunch for school then? And what happens if he has friends over or he goes to somebody's house? How do you handle that?
The great thing is when he has friends over, we'll make his friends food. And I remember one time I had made, are you familiar with the brand New Vegan?
Yeah.
So he has a recipe for carrot dogs.
Yeah.
And I hadn't tried them before, so I decided to try making those. And so I made these carrot dogs and gave them to my son and his friend who is not vegan, not vegetarian. And he said, "These are the best hot dogs I've ever had."
That is fantastic.
If you give it to him, you got to give him a chance.
Yeah.
But when he goes to other people's houses, he's old enough now that he understands. He's able to read labels.
Yeah.
He knows why we eat this way, so that if people are asking him, he can have a conversation about it and why he chooses to continue to eat that way. And so he's very familiar with that. And we also have conversations with parents too, where we'll say, "Hey, by the way, this is how we eat. So if he's going to have anything at your house, just make sure that it is, it doesn't have animal products."
Nice. Yeah, it's doable. We have 3 grandchildren and they have also been vegan since day one. And, they just accept that this is how they eat. They don't know anything different, like your son. They just don't know anything different. And so they think it's perfectly fine. Robbie has another question for you, Dr. Davis. Robbie says, "I'm low in iodine. What would you recommend as a supplement?"
So there are iodine supplements out there. It would really depend on how low your iodine is, why it's low. So I don't want to say a specific amount for you. I would say that you definitely want to talk to either, your primary doctor. One of the plant-based doctors would be happy to help to try to figure out how much you're going to need. There are other ways you can get iodine as well. Sea vegetables have a good amount of iodine in it. So, there are definitely some different options. You also don't want to have too much iodine though. So you have to be careful. It's not one of those supplements that I recommend that you just take because you're worried that you're not going to get enough iodine. There are ways that we can check your iodine level. And I would recommend doing that first before even considering taking iodine, because there is some research that shows that people who have excess iodine are actually at even higher risk of having problems with their thyroid than people who are too low in iodine. So you definitely want to be careful.
Yeah. So again, another thing that you could have tested, see exactly where you're at, and then have a consult with your physician to figure out what the best course of action would be. Love Pudding wants to know, could a plant-based diet impact, is it tinnitus?
Mm-hmm.
Nothing else.
Oh, yeah.
Mm-hmm. Does Dr. Nikki have any recommendations?
Yeah, that one's tough. Tinnitus or tinnitus is ringing in the ears. And often that's a sign that you are starting to have some hearing loss. And that's, as we age, that is something that is pretty common to have. And that's one of the first signs. Now, of course, it can be due to some other things. So that I don't want it to be a blanket statement that that's why you have ringing in the ears. So you definitely want to make sure that if that's going on, that you've brought it up to your doctor so that they can do a further workup to see if there are any other causes of it. But I have not seen that a plant-based diet necessarily has helped improve that. It's just one of those things that as you start to lose your hearing, that's going to be what your first sign is.
Okay, thank you. So Gail looked up the Twin Labs B12 Dots. She says it comes in micro tablets that dissolve in the mouth in a purple and white box. And they also have the sublingual in a bottle. Do you have a preference on which one to purchase?
So I personally do the chewable one. That's it's not the sublingual, it's chewable. And my entire family takes that one, and we just put it in our mouth and let it dissolve. So we don't actually chew it. We just let it dissolve in our mouths.
Okay, perfect. Thank you. See, this community, they're fast on this stuff.
Oh yeah,
I
I like it. Yes. And in fact, and I think I have a link to the actual one that I take on my website. If you go onto my website, it will say store, and my affiliate links are in there, so that if you're curious exactly which one, it'll show up on there.
Okay, great. So we just want to remind everybody that in the description underneath the YouTube video is all the links are there, so that if you want to book an appointment with Dr. Davis, the plant-based telehealth link is there. If you want to visit her website, that link is also there. And then let's talk about, you have a couple things coming up tomorrow that people can participate in. So let's tell them what you have going on tomorrow as well.
Yes. So I'm excited. I get to talk with Chef AJ on her YouTube show tomorrow. So that's at 11 a.m. Pacific time, or noon Mountain time, which is my time. I'm in Utah. And I'm going to be making several different ranch dressing recipes. So the reason I'm doing that is because I have been looking at making a ranch dressing recipe, and there's so many different ones out there that are oil-free. Some of them are nut-free, some of them have cashews or some other nut. And I really wanted to see which one I like the best. So I'm going to make several of them, and I'm going to see if I can get my kiddo to come in and taste test with me as well. But we're going to be trying a bunch of different recipes to see which one we like. And so we'll be doing that on Chef AJ's show tomorrow. And then the other thing that I'm doing is a webinar, and it's called Plant-Based Eating Made Easy. So it's all about making that transition, or making your already plant-based diet easy. And so that's where
I'm showing it there.
Yeah, perfect. Thank you. And so we just talk about how to keep it really, really simple. I know, Tami, we already talked about this, that's how you and I keep things sustainable. Yes. We keep it going, is you got to just keep it really simple. And so we go through a lot of ways to just make eating plant-based simple, inexpensive, easy. You don't need complicated recipes, and really just making it to where, either if you're someone who's looking to make that transition, that it makes the transition a little bit easier, and kind of some things to look for, things to look out for. But then also, if you're already plant-based and you're having a hard time sustaining it, just some other tips on sustaining it and making it a simple way to live.
Yeah, and we want to point out that it's a free event. They do need to sign up through Eventbrite though, yes. And it is tomorrow, and we have the link for that is in the description below this YouTube video, you guys. So yes. You'll just click on that, go over to it, fill out the information, and then you'll get the link to be able to attend that tomorrow. So,
and it's 5 p.m. Pacific, 6 p.m. Mountain time.
Okay.
And it is a live event. It's on Zoom. And then if we have too many people for the Zoom event, we are going to be streaming it live on Facebook as well. So as long as you sign up on that Eventbrite, you'll get all that information for where to go to watch it.
Okay, great. And if you go to the plant-based telehealth, I just want people to know, take a look around that website. There are videos there that you can watch. There's webinars there that you can watch where the plant-based telehealth doctors have done like a Zoom call, and one question comes up from like a patient, and then lots of different doctors give their opinion about it. And so that is really fun and fascinating, and you can spend a lot of time there. But you could listen to it while you're out walking in your neighborhood too. You don't have to
Yes.
be passive and sitting down. We have a question from Cheryl Atkins. She wants to know if Dr. Davis has seen whole food plant-based has it helped a whole food plant-based lifestyle helped pulmonary fibrosis?
I have not come across that yet. No, that's something that I would have to look into to see if there has been any research on that, but that's not something that I've come across quite yet.
Okay, great.
I-58 firms.
And I was going to mention with the plant-based telehealth, all of the doctors do a live Q&A that's free every other Thursday. So we do those, and you just go onto the plant-based telehealth Facebook page. You can also sign up for the Zoom, so you can be part of either the Zoom or you can just watch live on Facebook. But it's really nice because you can go on there and ask questions to the doctors.
Yeah, that is great. And so what time is that on Thursdays?
Oh gosh, I want to say, I think it's 10 a.m. Mountain Time, if I remember right. Something like that. But it is on the Facebook page that you can see.
Okay, great.
Let's see if I can see it on my, let's see. Oh, actually I was wrong, 12:30. So 12:30 Mountain Time.
Okay.
On the second and fourth Thursday of the month.
That's great to know. Wonderful. Okay, so Tom's telling me there's another question here that I've missed. I'm looking for it.
I'll go ahead.
Okay, if you would.
Yeah, so I-58 Firms is asking, is plant-based telehealth available to Medicare recipients specifically?
It is, yes. There are certain doctors. So when you go onto the website, it will ask you not only what state you're located in, but whether or not you have Medicare. Once you put those in there, it will automatically populate which doctors you can see.
Thank you.
That takes all the guesswork out of it, you guys.
Yes.
It makes it super, super easy. Do you have a private practice there in Utah where you're at, or do you do all telehealth?
I do all telehealth. I do some other independent contract work where I go see people in their homes and do some assessments, but for the most part, for lifestyle medicine right now, I'm just available through telehealth.
Okay. I just thought, in case somebody from Utah is watching,
yes,
like, oh my goodness, where is she close to me? Because, we have a handful of plant-based doctors where we live, but they all book up and then they can't take any more patients. They're like, I can't take any more. I'm like, but we only see you once a year.
Right.
We're not going to overload you. Really. We just, we could do a Zoom call because we're so healthy. It wouldn't be that bad. So, okay, another one. Robbie wants to know, do you consider yourself a functional doctor as well?
Nope, I don't. So functional medicine is a different specialty, and it does try to look at the root cause of problems. But I do find that a lot of functional medicine doctors tend to prescribe quite a few supplements. And I'm definitely not a fan of supplements. Besides B12, you definitely need to take B12. But I usually will not ask people to start taking any other supplements unless needed, unless we find that there's a deficiency.
Okay. That's great. All right. Well, I think we can stop there. You guys, we know that it's a big event on TV tonight. The Oscars have already started. So thank you to everyone who hung in here with us, especially thank you, Dr. Davis, for being here and answering all these questions. And if anybody is looking for a plant-based consult, please go to the plant-based telehealth and look for Dr. Davis there. You can also see what people specialize in. You can read everyone's profiles and see what they specialize in. And just know also that when you do contact one of the physicians there, they have all the other physicians to consult with as well. They can say, hey, I have a patient that has XYZ, and what do you guys think about this? So you also have all of those experts behind every one of the physicians. So it's very exciting. So thank you so much. You are a lovely guest, and I've just enjoyed listening to you, and I've learned so much tonight. And I know, Tom, yes, we would absolutely love to have you on again. And
absolutely.
Yeah, it was just wonderful. Do you want to come on so you can say goodbye too, Tom?
Hello, goodbye.
Hi. Well, it was
we've
just
been
so
busy
nice.
over here. It's been a busy chat night, and thank you for taking all the questions from the chat.
It's my pleasure. This is,
And
I left my rocket company job to be able to do this, and it's just my pleasure to get to do this every day. So it's,
yes.
you
Well,
know,
that, and it shows your love of it and your desire to do this shows. And what a wonderful thing to be able to get to have what you're passionate about also be your career.
Yeah, and we've had a couple of hundred people watching the entire hour or hour and 15
wow.
minutes. So thank you for everybody for being here. Wanda did get here. She got here late, so she's going to catch her answers on the replay.
Oh, okay.
So thank you for taking those detailed questions.
Absolutely. Yes.
Yeah.
So yes, we do have a couple of housekeeping things about our upcoming shows we need to cover with everybody. So we don't have to, take up your time with that. We are moving our show. We're going to talk about that, everybody. We put it in the newsletter, so people that subscribe to nutmegnotebook.com already know what's going on with the moving of the show and why, but we're going to go ahead and explain that to everyone else. So thank you so much for being here with us today. And if you'll click yourself off, then we will actually stay on, because we got to keep streaming through this Zoom thing to finish the show.
All right.
Well, thanks
Thank you so
again
much
for having
here.
me, and thank you everyone for sticking around, and thank you for all your questions. I really appreciate it.
Yeah, this was wonderful. Thank you, Dr.
Thank you.
Davis. Good night.
Bye.
Wonderful. Wasn't that was such a treat.
She is a great guest. So informative.
She is. She's just so sweet and just so nice and easy to listen to.
Yeah, I think we caught most of the questions in the chat feed. If we missed you, we're sorry. And we'll, again, if you're signed up for nutmegnotebook.com, we send out an invitation for people to submit by email if they have got really specific questions. And so we did cover those. But the chat is great too. Thank you for putting in the question marks.
Yeah, and you can follow her on Instagram. Also, I follow her on Instagram, so you can put in Dr. Niki Davis, and you will be able to find her on Instagram.
Okay.
So she does post on Instagram as well.
And there might be an opportunity for some comments and posts in that.
Yeah,
form.
Sure. And you can, and certainly you can go to her website as well.
Okay.
So yeah, she's great.
All right.
She's just great.
Okay. Our next show is this coming of next week, Thursday.
This coming week.
Today is Sunday, right?
Yeah.
So we're going to be back here soon. We're going to be here Thursday morning at 9 in the morning. And as I mentioned to those that get our announcements / newsletter, we're recapturing our weekends for family time and personal time and going on family adventures, and it's actually syncing up our schedule with the rest of our extended family here in Northern California. And we're moving to that Thursday morning slot, 9 o'clock early, because we want to have our show be on and off before other real regular shows start coming on.
Who would that be?
I think we just want to be done before that 11 o'clock spot, that very popular 11 o'clock spot.
We don't want to interfere. Yeah, I was going to say, we don't want to interfere with our friend Chef AJ.
And then but the other side of that same coin is by going on at 9, being off by 10:30, that allows us the rest of the morning for additional shooting additional footage, what we call uploads in the YouTube world, where we're uploading a recipe or uploading something that we've prepared in advance, edited and posted on our YouTube channel or on Facebook or Instagram for that matter.
Yeah.
So, this time slot, we're tired, we're hungry, we're going to eat, watch TV program, go to bed. So there's no production going on tonight. But with the Thursday morning thing, we are thinking not only will we recapture our weekends for family and personal time, that we actually may be more productive in producing value-added content for you, the viewers. So we're hoping everybody wins on this. We want to say give a virtual hug and thank you to our moderator Randy, because we will be losing her in this move because she works in that time slot, and she was very busy today.
Thank you for working so hard on your last day, Randy.
Yeah.
But any Thursday that you happen to have off, if you want to join us, we would love that.
Yeah.
What happened to that?
Oh, we don't need to know I bumped the mouse. That's the weather. That's the weather.
I was like, wait a second.
It's 65 degrees, everybody. So anyway, but Tiffany and Jesse, we believe we know are going to be following us to that time slot as things have worked out.
Yeah, we're very excited because it's going to allow us to have more family time on the weekends and get to do more things with the grandkids. Yeah.
Now, as I stated in the newsletter, for those of you that are really tied to the 4 o'clock slot on Sunday evenings, you can save that Thursday show and play it on Sunday at 4 o'clock and not have any part of your life disrupted. So that's there too. Okay.
There you go.
So anyway.
Yeah. So if you work or your schedule doesn't allow you to watch us Thursday mornings, the replay will automatically be there as soon as we're finished. And so you can always catch the replay. And
Tiffany's still trying to capture her lost and misspent youth. we want to capture our senior years moving forward. So make good use.
Jessie says she's trying to recapture her lost and misspent youth.
Tiffany.
Okay. Yes.
All right. Okay.
And Jessie says that Randy will follow us to Thursdays in spirit, if not in the digital.
So we're having a cooking demo. You and your guest are both cooking.
No, I'm cooking. So on Thursday, Sia from 60 Living is going to be with us, and I'm actually going to be making 2 of her recipes, and she's going to be talking to us about
sprouting,
microgreens, and sprouting.
Okay, so this is a lady previously that we've had on talking about intermittent fasting, but this episode is about food and nutrition and healthy eating.
Yeah, we're going to do a couple of her recipes, and I'm going to make a couple of her recipes, and then she has a beautiful garden and she sprouts all kinds of things and she grows microgreens. And so she's going to talk to us a little bit about sprouting and microgreens. So it should be a really fun morning and a good way to kick off our Thursdays. And then we have a lot of fun stuff coming up in the month of April. So the following week, it'll be you and I will do an open Q&A. That's actually going to be on our anniversary, our wedding anniversary.
Yeah.
And so we're going to do an open Q&A that morning. And then we have...
and then we're going to go celebrate somewhere, somehow.
Right. And
depending on what's out there available and open.
Yes. Yeah. And then one Thursday we have Nan coming on with her book, and she is a friend of Chef AJ's. And so we'll be talking to her about plant-based lifestyle, and that's going to be really fun. And Elspeth, the Speedy Vegan, is going to come on. She's going to do a cooking demo for us. And, she creates just gorgeous, beautiful food and delicious recipes. So that will be fun. And then Fridge Love, the author of Fridge Love, a new book. She's nutritarian, and she'll be on at the end of the month.
So April is a full and busy month already.
It is. We've got it. We are full. Okay. April is full. So lots of fun stuff coming up. If you haven't subscribed to Nutmeg Notebook, go over to the blog, nutmegnotebook.com, and subscribe. We'll put you on our mailing list. And once or twice a week, Tom sends out an email just to let you know what's going on. So that you know that we're changing our show, so that you know who the next guest is or whatever we have coming.
And we do alerts on when we're going to do, because we're also on the Amazon Live video platform. Our last program was really a full-on cooking demo. There was a little bit of product information from that, but mostly it was a cooking class. So, sometimes sometimes they're all about products, but the last one was all about cooking. So
yes,
I did put link to that in the newsletter.
Yeah, I made an entire meal. I made 5 recipes. It was an entire Mexican themed meal, including
Yeah, it was
dessert
timed.
with-
It was like this.
Yeah, well, we practiced it. What you guys don't know is that we did a complete run through with all of the recipes a couple days before and timed it to make sure that I could get it
Well, 'cause
all
Amazon
done in
gave
1
us
hour.
1 hour. We had to be on and off in 1 hour because we were part of a series of shows that they had
Yes.
asked people to do. So,
Right. And so we practiced it all, the whole thing.
yeah.
And to make sure we could get it all done in 1 hour, which I
Okay.
had it timed
Yeah.
just perfect. Even with all my chat.
Speaking of the time, I wonder who's winning best dressed. I mean, best picture.
Well, we're recording
Best
it, so
dressed
we
or
can.
best picture?
I don't know. We're recording it so that we can get to see it. It seems like I was going to say something else, and now I can't remember. Oh, and we put up a new video this week because we were showing Hall and Bowl Mills
show and
new
tell.
wooden utensils. So if you didn't see that video, take a peek at that video. It was a short video, but we showed you all the beautiful.
For Nutmeg Notebook, it was a short video.
Well, how long was it?
I don't know. It's like 16 or 17 minutes.
That is a short video for us.
Yeah. In YouTube land,
Give
the
me a
short video
break.
is 3 minutes. So
Yeah, that was a short video. And so so we're having fun with those, and everybody seems to really love the rice paddle, the wood rice paddle.
yeah, because I'm sick and tired of those flimsy plastic ones. I'm glad to have a real one.
I know, it's so
It's
exciting.
like, why didn't somebody invent that sooner?
I don't
Oh,
know.
wait, they did like 300 years ago. Okay.
Yeah, so that's all. I think that's all that we have going on right now, isn't it? Oh, I hope that's all we have
Yeah.
going on right now.
There's a lot of dialogue going on here amongst folks that have come to know each other on the Sunday night show and how they might stay in touch.
Tiffany says Tami gets best dressed tonight at the Nutmeg Oscars. Thank you, Tiffany. I said to Tom, I think this shirt makes me look fat because it's big, baggy, and loose.
I told her, no, it's just cute.
And he was like, no, it's cute because I was going to go change. I was like, I just feel like it makes me look fat.
Yeah, she saw I put this on the thumbnail for the YouTube posting, and she said, oh, I can wear that tonight. So,
but then I put it on. I was like, oh, it's big and flowy, so it makes me look kind of big.
no, it's very feminine and pretty.
Okay.
So I told her it looks
He
nice.
said, keep it on. So I did.
Okay.
Just to please you.
Thank you.
After how many
Appreciate
years? Well, how many years are we
That's
celebrating?
That's not a fair question at this time of day.
On our anniversary. How many years will it be? I could tell you.
Okay.
Do you want me to tell you?
That 1979, that's 21, gets us to 2000, and now it's 22, so 43.
Yeah,
43.
43. We'll be celebrating 43 years.
Okay.
Yeah, of happy.
Next week.
Well, yeah.
Okay. So
Next week.
we have toyed with the idea of a Facebook location. Discord servers have come along now.
Oh yeah, let's do that. Let's get their input on that.
And so has anybody heard of Discord server? Because that allows folks to post just like in a chat room. Or if you see that somebody's little green light is on, you can actually somehow engage them via voice, kind of like that.
Clubhouse.
Kind of like Clubhouse. So we're exploring a Discord server option for Nutmeg Notebook viewers to be in touch with us and with each other. The Facebook thing gets unwieldy to moderate and
Well, if we
and-
had a Facebook group, I would have to have moderators for
Yeah.
it because I just don't have any more room bandwidth in my day to moderate another social media platform.
Yeah.
So we've talked about like, should we have a Facebook group for our community? Would you guys all like someplace that you would be able to?
So if you're watching the
meet up and
replay,
talk.
share your thoughts in the comments down below. And we'll be signing off momentarily. So
Jessie says that she has a Discord account. Conrad said, I love Discord. Jessie says, Nutmeg, Discord is nice. Please do not do Facebook.
well,
Okay.
in my initial research, that it seemed cleaner and simpler, and I was intrigued by the voice option.
So my question about it is, I know that people like to be able to share photos and pictures. So you don't have that option then with the Discord.
I'm not thinking that Discord is like this chat feed right here. I mean, it's like email. It's like looking at your emails. I can show you on. We're on a Discord server with the Amazon group with all of the other Amazon live streamers. So we're in that streamer community.
Yeah.
And so we're talking to each other about, tips and tricks in that community. It's also where we get announcements from Amazon on what we need to be aware of. So, so it's got both a social aspect and a business aspect, because there's different categories that you can put in there. So worth exploring. We'll explore that. No promises today, but I hear what you're saying about being in touch with each other and with us.
Yes. And we're like, well, everybody's gotten to know everybody in the chat feed. Wouldn't it be fun if we had a place for everybody to gather so that, in between, you guys could still be talking and we could chat with you and hear what's going on as well, or be able to ask you.
Yeah. So if there's something you
questions.
might be interested in the future, make sure you're signed up at nutmegnotebook.com as a subscriber, because that's where I would send out, it's by invitation only. I would have to send out
an invitation
to all Nutmeg Notebook subscribers to join the Discord server. That's how that would work. So anyway, and I'm not committing to that right now. I'm just letting you know I'm exploring that since this other conversation was going on. We better get off the air.
Yeah. And Tiffany says that, being able to post pictures is ideal. And although Discord does sound good too. So, and some people are saying the only social media they use is YouTube. They do not like Facebook and are not familiar with Discord. So
Discord's not new. It's been kind of a business thing, but it's
Conrad says, yes, you can share pictures and videos on Discord. Okay, well, that could make a difference, because we're brand new to Discord. We've had it a week. I'd like the ability to be able to share pictures with people. So so maybe that is a possibility.
I made an account for her, but I haven't invited myself to it yet. So I get to be the first one. Okay. All right. Okay. We got to go.
Okay, you guys, thank you so much for joining us. Randy, Tiffany, and Jesse, thank you so much for moderating. And Randy, we're going to still keep our little chat group going. So
she can continue to cause trouble.
Well, she doesn't always, you know what? She causes us to spend money, because she always finds all these really neat things that we all want.
Tiffany was talking about that too.
Yeah. Randy.
Thank you for those fine recommendations. They've been very helpful. Appreciate it. Okay.
Thanks so much, you guys. I'm Tami.
And I'm Tom.
And we help you get healthy and stay healthy, one meal at a time.
Bye-bye.
Thanks for watching.
See you Thursday morning at 9. Bye.
Bye.